Hi, everyone. My name is Anthony Salgado. This summer, I was tasked with examining an intervention that would help reduce the risk in cases of HIV in the most resource-effective manner. I chose an adolescent population because they are often forgotten. It is a period of sexual activity, yet they are not considered adults. As a result, research and ethical guidelines made studies on this specific population scarce and difficult to find. Despite all of this, adolescent girls and young women make up 6,000 new HIV cases weekly, which is a large percentage of total new HIV cases. This makes the lack of studies on interventions nearly unacceptable. I began a pilot and then full text review of around 3,000 studies this summer to prove that interventions like education, male circumcision, and antiretroviral therapy were a necessity in the reduction of HIV. I chose to focus on antiretroviral therapy, and more specifically PrEP, because it is a relatively new drug, and competing brands have made this medication more cost-effective and viable for large-scale interventions in recent years. PrEP also has an estimated nearly 100% effectiveness rate to reduce the risk of HIV when taken correctly. However, there are many challenges to ensuring the medication is affordable, accessible, and applicable to many diverse populations. In simple terms, if PrEP was less expensive, people would correctly take their treatment. When PrEP was combined with education and funding, people would correctly take their treatment, and the risk of HIV would be reduced. Although it may seem obvious to say things like education and funding could reduce HIV risk, it is a lot harder to prove causation and effectiveness. When dealing with policy research, interviews are a core component of policy recommendations. Reading interviews of real people helps show the struggles they dealt with. This could range from many community or even family-based issues. Domestic abuse led many adolescent patients with HIV to skip doses and be more at risk with their partner or family members who had HIV. Also, misinformation existed within many communities, often spreading and leading patients to think PrEP made them completely sterile. The battle against misinformation has strong ties to socioeconomic circumstance and education. Furthermore, many interviews were found with youth who stated that the lack of privacy in their own homes to take PrEP was a major issue on why they stopped their own treatment. There's still much work to be done educating others about what HIV is and how exactly the antiviral drugs affect them. This stigma against drugs like PrEP and HIV is something that must be addressed. By combining interventions such as antiretroviral therapy, education, funding, community development, the risk of HIV can be reduced significantly globally. The policy implication of this is that addressing effectiveness is something that should be considered for any intervention. People of different backgrounds have different needs, and this difference was shown to make PrEP more or less effective. Additionally, disparity does not end with HIV treatment. On average, adolescent minority patients were far less likely to continue adhering to their PrEP treatment. Furthermore, 3/4 of Black gay men who were diagnosed with HIV were between 13 and 34. By allocating resources and focusing on these specific high-risk populations, PrEP can be even more effective, especially when provided at zero or low cost. However, a focus on younger patients is also a necessity. By finding ways to make PrEP more cost-effective, it could help end the disparity and the difference between treatment and be a viable option to help reduce HIV incidence. Thank you, everyone.